My name is Thembi Arries. I am a medical intuitive. I use alternative techniques to diagnose and treat illnesses. I've done this for over the years, and I've successfully diagnosed and treated people with the most complicated of illnesses, which have baffled even the best of some of the medical specialists.
Join us on their journey to better health and renewed hope. This is Dr. Alternative.
Welcome to Dr. Alternative. Welcome to Kabeja. Winter's here. I'm sure you can see we're wearing some jackets today, but it's a pleasant weather today anyway.
Hi viewers, my name is Lorica. We are back again this week with another exciting topic. It's cold in Port Elizabeth, but we are out here with our exciting topic. Welcome.
Today we're talking about skin problems. It's a big problem that's facing a lot of people, particularly the young ones. And I've prepared this clip for you. Please take a look.
The skin is the biggest organ in the body. It is the protective cover, and it is what makes it so difficult for doctors to diagnose, because they cannot see what goes on inside the body. They rely on symptoms which can be very misleading. When the skin looks like this, or even this, what does it tell the practitioner? Is it an internal or external problem? What are the factors that are at play, and how can you tell? In our show today, we shall look at different skin problems. We also have some exciting news for our viewers. Make sure you don't miss it.
Welcome back. As we have seen in the clip, skin is a big one. In that, as the clip is self-explanatory, it covers the whole body. And as you know, we're always talking from this show about the importance of diagnosing properly and how difficult it is to know what causes a problem to this person and a similar problem to this other one, and yet the causes are totally different. And that's because of the skin. Why? Because the skin is covering the whole body. So today, when it is not just the skin that's causing problems for diagnosis of other conditions, but the problem is actually lying in the skin itself, then what? So that's how we're going to be navigating this topic today, looking at how bad or how good are the indicators from the skin. And as usual, Lorica's here. She's got some questions, and we're going to be discussing about this topic.
Okay, thank you, Thembi. My question here today is, there are lots of different kinds of skin problems. Is the skin an external or internal indicator of a problem?
It's actually both, but it's largely an internal indicator. It's both. In what way? Because, I mean, and at some point, I would actually even think, where would you draw a line? Because even if you've been bitten by a bee, the reaction that you experience is internal. You know, whether it makes you swell or what, it's not just that sting that you have had on the outside that's causing. So it's actually a bit of both, but it's largely an internal problem. The skin is the reflection of what is going on inside you. So this is what I always say to those people that are smoking. People that are smoking. I can just look at a person and I say, this person smokes. You may be as pampered with the makeup or the whatnot.
The perfume and all that.
Let alone perfume, because perfume, that's for the scent. But the look, I look at you and I say, I haven't seen you smoking, particularly this one. I can just tell, not because of the lips, but because of your skin, because it actually is a reflection of what is going on inside you. So I would say it is largely internal, maybe 80% internal, but external. But even the external manifestations, the reaction is actually coming from inside. So it's largely an internal problem, really. Okay.
Okay, that's the common action that people take when dealing with skin is to look at external treatment. Is this good or bad?
That's bad. Bad in what way? Because it deprives you of a chance of attending to internal problems that have actually led to that. Because, I mean, if, for instance, you're having issues with, particularly on the face, at least on the body, you find people can just ignore until it becomes a serious issue. But it's the face that bothers people the most, because that's you. That's the first thing people look at. So when you notice that maybe you start losing your tone color, because remember, we're born with the complexion, a particular complexion, your color. And then you see it starting to change. And then what do? You go and buy something that's going to work on the external to restore that color,
To have an even tone.
Yeah, particularly this is more common with us Black people, because we don't want to be dark. It's this white mentality, and this bleach.
Go and bleach.
People are bleaching like crazy. That's the Black mentality. The white people are actually skin tanning to become darker. We are bleaching to become
white.
It's just crazy. I mean, it just shows the issues of humanity. But coming back to your question, so you find that mostly, even if you have acne, people, you go in the shelf, there are all kinds of acne treatment that this one it reduces the fat build up. This one it pops the pimple. This one, so, I mean, you will find there's a string of things that people will find in the shops to deal with the skin problem. So you can therefore not blame people for reacting in that way, because that's how we have been socialized. So you've been taught that, okay, if your skin is like this, here's the product. Even maybe your mother used the product. You recommend, okay, here, or maybe the mother even brings the product to the child to say, they say this one is good for, So that's how we have been socialized. So you can't really blame us for thinking in that same line, okay? But it may work for a little while, because like I'm saying, you find a person is using it and it's working for a little while. Maybe that pimple that was now like looking at you, you find that it's drying up, and now it's fine, but then it comes back again. Then it say, okay, maybe particularly the girls, when they're going to menstruate, then the pimples, they just mushroom up like that. So that's how we have been socialized, that you don't look at anything that's internal. Once you've got skin problems, particularly face issues, there's a whole string of different types of creams that you will find. This one is for dry skin, this one is for normal skin, this one is for oily skin. You find all types of things, but they are all dealing with external problems. So it's okay to deal with it, because remember, when you're sitting with a pimple, with the acne, you want something that's going to remove it now.
No.
You don't want to go out
and,
it's true.
You
want it to remove now. So The best, therefore, would have been, if you understood the implications, would have been to deal with it internally, and also because internally might not be immediate results, but to deal with it internally and externally. But the problem is we only look at it externally while the internal mess up is occurring and is the one that keeps on showing outside that why we find you responded in the past month, but now it's no longer, and then you change to another one. Then this one says, me, because the market is just flooded with all kinds of things. So what I'm saying, therefore, is external may be quick fix, and to some extent may even be more damaging, because you apply that thing. Particularly, I remember in the past, people used to use these bleaching creams. You find the person looks fine, the acne is sorted, but then you're never going to be able to reverse the damage, because eventually those things, they're damaging the skin. The bleaching part is actually damaging the skin.
Very strong.
That's why it was, what did they call it? I can't even remember what it was called. The particular ingredient that was in the creams themselves. Forgotten what it was called. But it was actually discontinued, removed totally, because it was really destroying the skin.
The chemical was
people.
Too strong.
Yeah. So then you find it is a quick fix, and like everybody's saying, you are a yellow bone. Those were not the terms that you used then. But these days they say, you are a yellow bone. But you're going to be yellow for a little while, and then after a year or so,
you turn
are a
pink.
black bone. Oh, you become a black bone.
But those chemicals are really terrible.
Yeah.
It
So
has a bad after effect.
I don't know if they still have them. Do they still have them?
They do. They have the one, keratin that the people are now buying.
Yeah. I don't know. Maybe.
And my friend is also selling it now.
Maybe they've changed the name because it was.
But it's banned here in South Africa actually to sell bleaching creams. So that's why the market doesn't move here in South Africa for bleaching creams.
But anyway, it's so what I'm getting at is dealing with it externally. There are so many dangers in doing that, because you're looking for a quick fix, which may give you the results, the immediate results, but the lasting adverse effects of that, you're never going to be able to reverse them. So that's the problem. So it's always best to let the body fix it, because the complexion that you have, your skin tone that you have, God has given you that skin tone. When it starts to change, the body is saying there are issues inside. So once you sort out the issues, then you find you will glow again. Yeah, so that's our approach from alternative.
Oh, it makes sense. Okay, then. In your work experience, how do you deal with skin problems?
Well, like I deal with everything else, because firstly, even any type of skin problem, there is a cause for that particular skin problem. So when you come and you are having skin issues, whether it's on the face, it's on the body, because you'll get those people that have got eczema. Eczema looks terrible, even if it's not on the face, because it does not hit the face that much, except in children, maybe around the eyes. But it's mostly the body, those areas, the most area, like elbows, the inner part of the elbow or the skin. But it looks terrible when it's really bad. Even psoriasis, the psoriasis is it's actually worse. Psoriasis is actually worse. So, but you'll find that the tendency with those kind of extreme conditions that affect the skin, like psoriasis and eczema, is treated with eczema creams. Even with doctors, you find that they've got these eczema creams that you apply. But because I remember even my firstborn, I mean, when she was a baby, few months old, she used to have eczema. And there was this particular dermatologist who used to give topical creams, you know, and you would, and you read on the cream itself, it says you must, side effects, it makes the skin to thin, it thins the skin. So you must only use when the eruptions have emerged. So meaning you just babysitting to see, oh, there it's coming again, then you just, you know, which is the pattern of treating conditions with conventional medicine, that you babysit and you suppress, babysit and you suppress. So I don't do that. I must check, why is this the problem? Because I mean, now I would know when a baby has got those issues of eczema. So I look at what type of a skin it is. In fact, I don't even look at what type. I look at what type after I've scanned you, after I've analyzed you. And then that will tell me what is going on, you know, with you. But now with my experience, because I've been doing this work for a while now, I can just look at a person, like I'm saying, I look at a person and say, this one is smoking, you know, or this one has got liver issues, or this one is calcium, or I can tell because of the experience I've had. But I still don't fail to scan people to see, because besides the skin, you'll find I will pick up a whole lot of other things. A skin is just one manifestation, but then I will pick up a whole lot of other things. And also people with fructose intolerance. Fructose intolerance has been a biggie, has been a big one. In what way? Because it affects aldolase A enzyme. Now remember, fructose intolerance involves 3 types of aldolase deficiencies. It involves A, which is the one that affects the skin the most because it's a tissue problem. It involves B, which affects the liver, and the liver affects the skin like crazy. And then it involves the brain. So aldolase A and aldolase B are huge in messing up the tissues, and therefore the skin, the liver, the skin. So when I therefore scan you and I see you've got, maybe you hyperpigmenting, like those people that you see have got serious dark patches, which is hyperpigmentation. There are even people who I've seen that have got issues of bilirubin. They look yellow. They are yellow bones, but they are sick yellow bones. I remember one particular client that I saw and visited, came to see me, and I was in Coxted at that time. And she was a yellow bone. Wow. She was a yellow bone. And she was actually on stage for lymphoma. You know, lymphoma had progressed so much. And now remember, the liver also produces part of the lymph, and it is a lymphatic system organ. So she had accumulated bilirubin like crazy. So that's why she was looking so, and everybody was like, she's sick, but she looks so beautiful. And that was bilirubin. It had accumulated on the skin, and she really looked like a yellow bone, like the term is saying. So what I'm saying, therefore, is with me, I go the same route that I go in all other types of illnesses, because the skin is also an indicator of what's going on. Therefore, I must get to what is going on, which is why you find that when I treat you, people will say, hey, I look so beautiful, you know, because those things that had led to your skin looking like that, I'm actually addressing them.
Okay. Can you give us an example of skin problem cases that you have treated and how you dealt with them?
Okay. Because of the time, I think let's first go for a break, and then when we come from the break, I'm going to answer or give you the examples of skin conditions that I have treated.
If you are fructose intolerant, you should not eat fruit. Otherwise, it will harm your health extensively. This is a genetic disorder directly connected to adelase enzyme deficiency. Diseases including tissue cancer.
My name is Rachel. I am 35. Well, I was diagnosed with GIST, which is gastrointestinal stromal tumours. It's really rare. It's a form of sarcoma. It starts in the connective tissues, and for me that was the lining of my stomach.
Liver disorders and mental disorders. How do you know if you are fructose intolerant? And even better, what food you must eat.
Welcome back. We are still talking about skin problems. And before we proceed with our discussions, I would like to tell you that I've got some news that might excite quite a few of you that we'll present before the end of the show. So make sure you stay with us. Before we went for a break, Lorica wanted me to give you examples of skin problems. This one problem, well, it's a 43-year-old lady who came to me biggish. You know those people that have got weight, but not obese, but she was noticeably big. And she, at the time when she came, she did not have anything to show on the skin, but she was really seriously having issues of the skin problem. But she was having what is called urticaria. Urticaria, it's hives. She said when she started, it was over a year ago when the problem started. And it emerged after she had just eaten meat. She said she loves meat, particularly the braai. But this particular instance, she had just finished eating, and then the upper lip started swelling. It was not sore, it just swelled up. And then she started having, blotches, hives on the body. But it was not a lot of places. It was more on the arms. Even there, you could just count. But they were itchy. The lip was not itching. It just swelled up. But then the blotches, she said, they were itchy. They were very itchy. Then she rushed to the chemist, and the chemist, they gave a allergy reaction medication, and that subsided after a short while. And then she forgot about it. And then after a while again, she was eating the braai again, such that she ended up associating with braai meat. She thought maybe if it's just cooked meat. She had the braai again, and then she experienced exactly the same thing. And then she took the allergy medication, and it subsided. But then she said what she noticed is that instead it ended up coming out of nowhere. Even if she has not had the braai, maybe she had just had meat and all that. But she linked it to meat, particularly red meat. And then she decided she was going to stop eating meat, particularly red. She stopped eating red meat totally, and she would just nibble on chicken. But then it not after eating meat, it would just come from nowhere. She would be sitting, and then she would start feeling the itch. And then she said those blotches, they started covering more areas. Then it's at that stage that she ended up going to doctors now, instead of just using those allergy medicines because they were not helping. So she went to see the doctor, and he said it's urticaria. Okay. And he gave her the antihistamines, which is also anti-allergy medication, but they were different from the ones that, because these ones were scheduled antihistamines. So she started taking, so then it was fine. But then it continued. So the reason why she ended up coming to me is because now it would just almost every month she would have, and it was blotching. I mean, she was having blotches all over the body, itchy blotches. And she said the other thing that made her panic was then she started having issues of when she has just had a bath, when she comes out of the shower, she would itch like crazy. Not before she showers. And not when she's having those skin eruptions, like those hives. When she's just bathing, she would just, especially if she's taking a shower, then when she finishes, she would itch like crazy. Itch that would just not go away. And she said, you have no idea how painful it is to deal with itchiness. Because she said, a person would think, when it's itching, you can just scratch, it goes on. She says, when it's itching all over the body and it's itching, she said you can even hurt yourself because you can take a rough stone and scrap, not just, scratch a little bit. She says it was terrible. And then she ended up, she said, she says, you see, I'm a big person. How can I not shower? How can I not shower? So she said, how do you deal with this? She said, that's when it started really working on her. And she said, people would say, no, you must just dry clean. You know what it means to dry clean, that you're not getting into the shower. You just touch up those areas, But she says, I'm a big person. I must shower. But I would dread going for a shower. But now I must go to work. So I would have to wake up early and only just take a little bit. And she said her shower, she made it a bit coldish instead of warm shower. And then she would dash in and dash out. But the problem was persisting. So when she came to me, because the doctors didn't know what else to do, they gave her all the kind of creams that she can use, but they didn't know why she was having this itch. Then she would deal with urticaria on this side, one side, and then it would be itching on the other side. So she was just dancing between these two conditions. And she says, I am so miserable because I cannot be with people. I can't be with people because then these are just going to end. Once then nothing is good anymore. Everything just goes sour. And if I cannot shower. She says, this is affecting me psychologically because I cannot be with people. And I'm a social person. I like to mix with people. So that was the lady that came to see me. And I scanned her. There were definitely quite a lot of accumulation because what happened, it was fructose intolerant. It was definitely fructose intolerance. So I told her it's aldolase enzyme, it's affecting your liver. And even the very first reaction of allergy, because liver allergies are linked to the liver as well. It's not only the liver, but they are linked to the liver. So in her case, it was definitely the liver. Okay. So then she's asking, but why with meat? Because the first reaction was with meat. So that was an indicator. And I'm saying, but you must understand that the liver is a digestive organ. Yeah. And it is not just only a digestive organ, but it is an iron storage organ. Okay. So red meat gives a lot of iron. Okay. It's not like only when it's dry, but red meat, particularly beef, gives a lot of iron. So that liver is accumulating quite a bit, and she really had iron overload. So it's accumulating a bit. So the reaction is stop taking this because this is what it's doing to me. Okay. So that's what I was saying. Then I say meat per se, even if it's not red meat, but meat is the liver as a digestive organ works harder. It's not just, when you eat meat, it is more pressure, putting a lot of pressure on the digestive system as a whole, not just only the liver, but the liver is involved there because it must deal with that fat. So that fat that burns, because remember, meat does not have to have a speck for it to be fat. It's got lots of fat in it. And the liver is working very hard to produce the digestive enzymes to break down fats. So you're giving it too much iron, you're demanding too much digestive enzymes to deal with that fat, and this is an ongoing thing. So it's saying, I cannot handle it. But that was the origination, where the problem was originating from the liver. But then what's hurting that liver? What's causing that liver to end up not being able to cope with the situation? I say, when you're fructose intolerant, remember, you're deficient on aldolase B enzyme. It's not only those three, but when it involves the liver, it's aldolase B. And the liver works harder in dealing with that. So that is why you'll find there will be people who are regarded as having alcoholic livers. The liver that's packing up as though you're drinking too much. And yet they've never touched liquor in their lives. That's because of aldolase B. So when you're fructose intolerant, therefore, you're eating lots of fruit. And she said, I'm eating a lot of fruit in between me and the meat. Fruit is my next, meal that I love the most. She says, I eat a lot, and now you're fructose intolerant, so that's why that liver is acting out, because it doesn't have aldolase B to deal with breaking down that fruit. So all your urticaria is linked to your liver. But what's happening in your liver? You are fructose intolerant, so aldolase B is deficient. And then I say, now with itchiness as well, the liver is involved there. How? Because when the liver is dealing with so much fat and bile salts, because remember it makes the bile salts, which are used to digest fats. So that's the function of the liver, to make those bile salts. But when there's an accumulation of that or no poor management of that because of the state of your liver, so that those bile salts, including bilirubin, they will be dumped under the skin. So once they hit the skin, you're going to itch like crazy. That's the condition called pruritus. Okay. So that's the dumping of the liver byproducts under your skin. So that's what causes the itch. But now the question is, why itch after the shower? Because that's what she was answering. Okay, I understand. Okay, the dumping. But it's not itching all the time. So why must it itch when I've just had a shower? And I said, because the liver is also an eliminating organ. It's a digestive organ. It's a storage for iron. It's for cholesterol. There are so many functions that the liver has got functions for. Even the lymphatic system, it makes lymph for your lymph drainage and all that. That lymph is coming from the. So one of the functions of the liver amongst a whole list is it is an eliminating organ. Remember, our system, our elimination system uses oral, uses bowel, number 2, uses urine, and it uses the skin. So the liver as an eliminating organ does not have an opening where it will do the elimination by itself. It uses these organs. That's why you find when we're treating it, people will say, I'm urinating, my urine is very yellow, because it's cleaning the bilirubin. Bilirubin comes from the liver. It's a byproduct from the liver. My stools are very yellow. That's the liver. I'm vomiting. That's the liver, because it uses that as well. That's why you find people will say, I feel nauseous, biliousness, and all that. That's the liver. So even the skin, the liver uses the skin to eliminate. So when you're showering, therefore, you are assisting that accumulation of pillows to actually come out, to be eliminated. And therefore, it's going to itch, because where it passes, it itches. But that's still the liver. So the liver is eliminating. So when you're washing and even when you're scratching, when you scratch, you're assisting with the elimination, your lymphatic system, because the lymph cells are directly under the skin. So when you're wrapping and you scratch, you're assisting even that lymph to drain. So the liver is involved in the lymph, the liver is involved in the bile salts, the liver is an eliminating organ. So that is why you find, therefore, because she's got liver issues, then consistently with that, she's having pruritus that is dumped under, and therefore, which is what is causing the itchiness. So what I did, therefore, with her, firstly, we established she's fructose intolerant, so no fruit for her whatsoever. Even with meat, I said she must just stay away from meat up until the liver has managed to get rid of all this build up of fat that it must eliminate. That's why she was even biggish, So when we started treating, she actually lost a lot of weight. She lost a lot of weight because that fat digestion, we kick-started that fat digestion. And that urticaria, she never experienced that again. The bad thing, because we had helped that liver to get rid of all that build up that she had accumulated over time because of the fructose intolerant and that fruit that she was also eating. But also aldolase A. Remember, aldolase A works with the tissues. The skin is not, when I'm talking about the tissues, I'm not talking about the skin. The tissues, I'm talking about the tissues of the different types of tissues, because we've got different types of tissues, even fat tissues, lipo tissues. So, but when you have fructose intolerant, because in her case, she was affected by both A and B. B is the one that I've already explained. But the aldolase A of the tissues, people that have got fructose intolerance, those are people that are very much exposed to sarcoma, which is a tissue cancer. And that is largely because of aldolase A. Okay. So in her case, aldolase A was affecting her, but the biggest culprit was aldolase B. So the fact that I stopped her from eating fruit and I gave her all the treatment that would actually chelate the build up from the tissues, because once you reach that level, you don't just do the detoxification of bowel movement, and you also have to drain the accumulation of the fructose toxic build up from the tissues themselves. So there is treatment that actually chelates, that draws, which we use even for people that you find have been exposed to all these chemicals, like maybe asbestos, or they work in in other maybe fumes. They're inhaling a lot of fumes, or in mines and all that. So those people, you cannot just think you're going to detox like everybody say, I am detoxing. No, you don't just do that type of detoxing, but you must actually do chelate the chemical or the toxic build up in those tissues. So that's what I did with her, and she never had issues after that again.
For me to also just chip in, I also know someone that is suffering at the moment with that problem. Because she says she can just sit and then she swells up and her body will be itching. Even if she wash her hair, she starts swelling up. The last picture she sent to me, her face was so swollen up I didn't even recognize her.
But then what are they saying?
She says she went first to the clinic, and then they obviously give her now allergics and all that, and then it still continued. Then she went to the hospital. They did some tests on her. They can't see anything wrong in her blood, but the thing is just continuously happening to her. So she's also like, she can't sit with people because it's really embarrassing for her.
Yeah, you see the problem, that type of a problem is not something you can detect from the blood. Because like I'm saying that in her case, it's the liver. Okay, that liver, what unless maybe you can specifically try and test enzymes that are elevated. But then even there, you need to specify which enzymes, because that's the thing with these pathologists, that even though that is why you find their book is this thick, they may be I mean, one doctor once gave me his book to say, because this person had hemochromatosis, which is iron overload built up, and that liver was like buggered, because of the iron and the hemochromatosis. But that one, the hemochromatosis, that's more genetic. You find that the liver, because naturally the liver knows how to manage those iron levels. Excess, it will get rid of. But when you've got hemochromatosis, you find it holds on to that iron. But then iron, when you've got excess iron, it's actually toxic. It damages that liver. And you find then it ends up spreading to other organs, like it will affect the heart. I mean, I've treated people who have got serious heart problems because of hemochromatosis. Others, the joints. Some people that you find have got serious joint problems. They say it's that severe arthritis, but they don't know what is actually eating your joints. They say it's in autoimmune. Hemochromatosis, when iron is dumped into your joints, it's going to finish your joints. I promise you. It's so sore, and it's corrosive. It eats on. So where it is sitting excessively, because the organ that's meant to keep it is the liver. But once it's dumped in other organs, whether it's the heart or it's the pancreas, people that have got diabetes, that's just not responding to anything, because that pancreas is being bashed by the dumping of the iron from the liver. So if you're sitting with that condition, you are never going to come right until you know that the iron build up is not because you're eating too much spinach or liver or whatever else, but it's a genetic one. So this doctor, therefore, sent, because this lady had come to see me, and I picked up that this is what was happening. So then the doctor, so I said, but then she had medical aid, but she did not have money to buy the medication from me. So then I said, go tell your doctor, this is the condition. Then he can just do the test, and then your medical aid will cover, So then she comes back with this big of pathologists. And he asked me that I must tick the area because it's so specific. Even that this specific enzyme, these proteins, this just on the liver. I'm like, I was shocked to see that they will dissect each. If it's this glass, maybe if they were to dissect this glass, maybe you'd get 1,000 glasses from this one glass, the way they dissect everything. So he was asking me if I can just tick, and then she can. I said, no, I can't. Well, I don't even know how they do their testings, So that's what I'm saying there, for that. When it is the liver, you will have a whole lot of things, but you can't think you're going to pick it up from blood tests. It's not, unless you're going to test iron. But then iron is already showing that you've got overload. But then why are you having overload? The blood work is not going to prove that to you. You need to know what's the story with your liver. Okay. So even in this case that you're talking about, therefore, I'll be able to see why she's having such serious issues of these hives. If it's hives, I don't know, because I haven't dealt with her yet. So, but the long and the short of it is, even when it comes to the skin, you need to trace from your internal organs or from your internal systems, why are you having the skin? Because the skin is a reflection, is the mirror of what is going on inside. Okay. All right.
Lastly but not least, I understand that you have some good news for the viewers. Can we talk about it?
Yeah. Okay. This is now a Christmas before Christmas.
Early Christmas.
Early Christmas. Yeah. I'm actually offering, particularly the young ones, but this offer is for everybody. That I offer those, especially those people that are sitting with serious skin problems like this one that you're talking about, who've been to every door and they don't know what's wrong, but you're sitting, you can't even go out or whatever, or you've got a miserable life. What I'm offering is that you can just take a snapshot, even if it's on the face. If it's on the face, you can cover your eyes so that for confidentiality purposes, or if it doesn't matter for you, then it's okay. Take a pic, but make a pic of that area that is a problem on your skin, and I will do that scan or the analysis of your skin free of charge. I mean, remember, we charge 700 for scanning, but I will do this particular one free of charge. So if you're in PE, you can come, and then I can guide you on how we can resolve that problem. And I promise you, there is no problem that is not resolvable, even how bad your skin looks, because we'll be able to get to the root cause of why you're having these issues, and you're going to glow like all your counterparts. Maybe even find a wife or a husband. Or a husband after this. No, I'm just joking. So those people that are sitting with skin problems, whether of any kind, all I'm asking is that you take a pic of those areas that are bothering you, because that's a mirror that's going to show me what is actually causing the problem, and I'll be able to help with the guide as to how we're going to treat that particular condition. But I am not going to charge, so you're getting 700 Rand free of charge of the scan. If you're in PE, you can come to us, but if you're outside, all I need is a pic but then make it a zoom pic, not a tiny or anything, so that I can get a good view of your skin. Is that a good one?
Yes, and then Thembi, can you just mention to the viewers for how long will you run the program?
Yeah, we're going to run this for a full month. And the exciting thing also is that the reason why I'm even offering this is because there are also companies that are alternative, that are making products that have actually blown my mind. And I'm like, if people were to have access to this kind of products, this would help them a lot. Not only, them, it's external, but me, I'll be guiding you internally what you need to do and what supplements and all that. So, but this offer is only available for a month. First come, first serve. So that's the offer that we're giving you this month, and we will give you offers. This is not going to be a once-off offer, because people have always asked, other whatever, So now, starting from today, this is the offer that we're putting on the table, and there's going to be a lot more, because there's lots more where this one is coming from. Okay? Yeah. Anyway, thank you for watching. We appreciate your support. That's why we're taking an extra mile to try and assist you. And goodbye.
Okay. Thank you, viewers. I hope we have nailed it with the skin topic today. Yeah. Looking forward for your comments and your inquiries and your book.
For those photos.
And for the photos. Yeah. And for the bookings as well. Thank you.